Hello, my name is Aleksandra Jones and I'm the editor of the Ophthalmologist. I'm here today with Mr. Alastair Stuart. Thank you so much for joining me. First of all, could you tell me about your background?
Hi there, I'm Alastair Stuart. I'm a cataract and refractive surgeon practicing at the London Vision Clinic, and it's a real pleasure to talk to you about the EMV lens today.
Thank you. And I have a few questions for you about the RayOne EMV IOL. First of all, could you tell me what makes it different to other IOLs?
The EMV is a monofocal IOL that increases a patient's depth of field compared to a standard monofocal IOL. So the important consideration here is that it's not a diffractive IOL, and for that reason, it's not associated with well-documented side effects that diffractive multifocal IOLs are, like night vision disturbances and reduced contrast. What it does is it increases depth of field through the induction of spherical aberration. So spherical aberration is a higher order aberration that can cause night vision disturbances when it exceeds certain levels in a patient's eye. However, there's a so-called therapeutic range of spherical aberration at which night vision disturbances aren't experienced by the patient, and that's because they're filtered and processed by the brain. And within this therapeutic range, increased levels of spherical aberration increase the patient's depth of focus. So this means in the real world that an EMV lens targeted to plano will give a patient increased levels of reading compared to a standard monofocal.
That's great, thank you. And do you use RayOne EMV differently with each patient? And if so, in what way?
No, not really. I pretty much have the same setup for every patient. For all my patients in which I'm using the EMV lens, I'm using it to achieve what I refer to as modified monovision. The reason that this is different to standard monovision is because of that increased induction of spherical aberration by the lens. So this therefore increases the depth of focus in each eye, and subsequently the distance vision of the reading eye and the reading vision of the distance eye are far superior to that you would experience with a standard monofocal IOL targeting to monovision. So in this way, modified monovision with the EMV gets around the well-known drawbacks and caveats of standard monovision. That is to say, tolerance issues from anisometropia, suppression, loss of intermediate vision, and loss of stereopsis. So what I'm doing for patients is I'm targeting plano in the patient's dominant eye and minus 150 in the patient's non-dominant eye. And I'm finding that gives them a very good range of spectacle independence across their visual field and requirements.
And could you tell me how RayOne EMV is positioned within your clinic as opposed to other solutions?
So I like to give my patients as much detail as I can about how these lenses are working. And what I say to patients is I focus on the fact that it increased depth of focus. I think that's a concept that most patients can get their head around. And I explain to them that monovision is a long-standing method for treating presbyopia, but that it has several drawbacks, as we discussed earlier, about the lack of tolerance, the lack of stereopsis, the suppression, and the lack of intermediate vision. And I explain how the EMV improves on these drawbacks by increasing depth of field. And what I'll say to them is that with monovision, standard monovision, patients will have one eye for distance and one eye for near, and the eye is totally separate and don't communicate. And what happens when you increase the depth of field for each eye is that you get synergy between the two eyes. So you then have a situation, as I'll say to patients, where their distance eye is doing the majority of the distance work, but their reading eye is then giving it assistance and vice versa. And so that synergy between the eyes increases the tolerance and gets around the problems that a standard monovision setup would have.
Mr. Stuart, thank you so much for joining me today. It was a pleasure talking to you.
Well, thank you very much for having me. It's a real pleasure to talk to you today. If surgeons want to get more information, then they can go to the website at Rayner, which is www.rayner.com/plus1 EMV. Or if they want to contact me, then they can certainly get in touch via the representatives at Rayner. Thank you again.